Here now with Dr. Meredith Craigie and Dr. Chris Hayes. Chris Hayes, you've just stepped down as the Dean from the Faculty of Pain Medicine, and Dr. Meredith Craigie, you've just been awarded, I guess, you're the new Dean of the Faculty of Pain Medicine. So first of all, congratulations, thank you both for joining us. So Chris, we'll start with you. What are some of the advances and highlights of pain medicine in the last 2 years? Can we just reflect on that?
We've had some very positive advocacy opportunities, so particularly to talk into the space around opioids, including codeine and the upscheduling there, and also issues around medicinal cannabis. So we've had some good discussions with our collaborating groups, including Pain Australia, consumer groups, and some input to government and the Therapeutic Goods Administration. So that level of operation has been great. Also some nice opportunities to discuss development of the training program. So in particular, we've been thinking about greater engagement in the procedural intervention space as it relates to pain. So doing some thinking around that has been good, and also the possibility of a 6-month certificate or diploma in pain medicine as a shorter form training option. So they've been very exciting opportunities over the last 2 years. And consolidation, I would also say, of EPOC, our electronic persistent pain outcome collaboration, because in all of the pain treatment that's offered these days, evidence becomes crucial, and there is a degree of clinical variation, and mapping that with good outcome measurement is critical.
And now looking ahead, what's your vision for the next 2 years?
Well, looking ahead, we're clearly going to continue some of the good work that we've already started, particularly with progressing the offerings in our training program and these separate offerings. So it's trying to make information about pain medicine and modern practice of pain medicine available to not just a select few in the faculty, but also more broadly engaging with other colleges, particularly the College of General Practitioners, and maybe our surgical colleagues a little more closely around issues to mostly deal with opioids and the challenges that our community is facing in that place, so that we're going to progress that with an opioid forum, so continuing the processes we started last year with engaging our faculty community, but also people outside of the faculty, at a forum on June the 16th, and from there perhaps revision of our professional documents around opioids in pain medicine broadly across the spectrum from acute through to cancer pain and in chronic non-cancer pain. And our last area that I'm particularly passionate about is in the health and well-being of our fellows and our trainees. Pain medicine can be a rather challenging discipline and can be extremely emotionally draining, and we're seeing some of the challenges being reported in our recent surveys of both our new fellows and our trainees. It's a big issue for the College of Anaesthetists broadly, and I think we'll be reflecting and working with them to progress those issues around practitioner wellbeing. So it's quite some exciting times ahead, and I'm sure we'll be having new challenges pop up that we will address as they come along. But opioids and health and wellbeing are really key areas for us in the next 2 years.
Yeah, perhaps your most difficult day to start with is carrying your big new necklace around.
It is. It's quite a sort of weighty load, but I'm looking forward to the next 2 years and really looking forward to engaging with our fellowship, and I hope to be able to get out to the regions and have more conversations with people as we try to support our fellows but also hear their views and develop our policies around what the fellowship want. So it's an important period of time, I think, in the evolution of our faculty. We've just turned 20 years old, and we're looking forward to emerging from our medical adolescence, you might call, into being a fully functional and fully fledged faculty that is having a good impact on the community in terms of working with government and other government departments, as well as trying to engage with the community. So exciting times.
Yeah, definitely. Thank you so much for joining us, and congratulations again.
Thank you very much.